Hi, Derek. How are you doing today?
Doing okay, just a little sore.
A little sore.
Yeah,
But what's bothering you?
my back's just killing me.
Right.
My lower back. This position's actually not too bad, so I like to lay on my side a little bit. So
Okay, good.
yeah.
Yeah. So my name's Michael. Just to introduce myself, I'm a student physical therapist here, working under Dr. Clausen. And today he actually sent me in for that back pain, that lower back pain that you're experiencing. Something that we or Dr. Clausen felt like would be really helpful is if we applied some ultrasound onto your lower back. So if you've ever heard of ultrasound, basically it's just going to be using this little apparatus here applied with some gel to your back. And in here is a little crystal that resonates and vibrates this head. And the vibrations are going to be sent through your lower back, through those tissues. And the goal of those sound waves going through your tissues is to kind of, in more scientific terms, it's called microstreaming and cavitation. But basically what that is just kind of making your cells move and affecting the fluids of the cells and uh, instigating and helping the tissues regenerate a little bit better. Okay, so that's what we're
nice.
gonna be doing.
Yeah, that sounds good. I like that.
Perfect. So the indications, particularly for this patient, is the pain. Ultrasound, we're going to be using that to modulate that pain in her lower back. Or I guess in the case it's a female, but Derek is obviously not a female. The contraindications for the use of ultrasound in this case, the case previously had a history of being pregnant a couple years ago, and she suspects that the back pain is coming from because of the pregnancy. So one of the biggest contraindications is pregnancy, especially applying it to the abdomen or the lower back. So I would ask her if she is currently pregnant, and if so, then we would not use ultrasound in this region of her body. Other contraindications are decreased sensation and circulation of the area, as well as open wounds, history of thrombosis, tumors, any malignancies of that sort, and any kind of cognitive uh, decreases as well could be a contraindication for ultrasound. So, alrighty, Derek. What I'm going to have you do, if it would be all right, could I have you roll on your stomach for me?
Mm-hmm.
Oh, yeah, sorry about that. That was kind of painful.
That's okay. Oh.
So what I'm going to have to do, so in order for me to apply the ultrasound, I'm going to have to get to your skin of your lower back. Is it okay if I lift up your shirt to expose that part?
Yeah,
Okay,
of
perfect.
course. Thank you for asking.
Of course.
I'm a little insecure about my body, so thank you for asking.
We'll bring this a little closer. Okay, so for the parameters that we're going to be putting in, because the issue is lower back pain, the tissues that are affected are mostly going to be pretty deep. So we're going to put this to sound for ultrasound. And because we want it to have deep penetration, we're going to keep it at 1 megahertz. The duration usually is about 5 to 10 minutes. And when we're looking, especially because we want it to be thermal ultrasound, given that she is in the more chronic phase, the maturation remodeling phase of tissue healing, because it's a chronic pain, it's nothing acute. Thermal ultrasound is indicated, whereas thermal would not be indicated, would be contraindicated in an acute setting, an acute injury. So we'll keep it at continuous, making it 100% duty cycle, implying thermal ultrasound. And for the intensity, because we're going deep and we're not as worried about energy being absorbed in those superficial tissues, we're going to put it to 1.5 watts per centimeter squared. What I'm going to do is bring my chair over. Make sure I have good body mechanics as I'm applying this ultrasound. And what I'm going to be doing. Alrighty, Derek. So just again, I'm going to be applying this to this lower part of your back. Is that okay?
Yes.
Okay, perfect. So I'm going to apply this coupling medium to the, you could apply it to the skin or straight to the head of the ultrasound tool. And what we want to make sure is that as we're applying the treatment, we don't want to deviate further than 2 to 3 times the size of the effective radiating area of this ultrasound head. So it's not going to be any bigger than about this much of a surface area per se on the lower back. So I would start, and I'm sorry if it's cold, it might be a little cold. I'm going to start circling, kind of applying in that region of pain. And then as I'm moving, I would press start. And I'm just trying to make small circular motions, not going too fast or too slow. We want to give the sound waves time to penetrate into the lower back and do what they're meant to do. How's that feeling, Derek? Do you feel any, is it kind of warm?
It is a little warm actually.
Okay,
The
good.
gel was cold, but now it's not as cold, which is really
Starting
nice
to warm up?
Yeah.
Very good. And then upon completing, for this video's sake, we're not going to go the entire time, but for sake of the video, as we are finished, we would make sure that the ultrasound head is still in contact with the patient as we stop the treatment, and then we can remove it. The reason we do that is to protect the physioelectric crystal that's inside. Otherwise, it could break. And then we would just clean off the ultrasound head. And also wipe off this gel from the patient. And cleaned up, make them decent again. And then after that, we would continue on to the rest of the treatment.